Okay, I'm recording. So welcome everybody, and thank you so much for taking the time out and to join us on this first presentation, inshallah, hopefully first of many. I'm really honoured to have Dr. Rahat Iram to walk us through this topic. It's a passion of hers, and I think some of you that were on just before probably heard her story, but for the people that are on the recording, I just wanted to give a brief sort of précis. So Dr. Rahat qualified in Pakistan and then came over to the USA, carried on her sort of studies by doing research and worked in pharma, then moved over to Canada and did an internship in pathology, but for reasons of her own health she wasn't able to continue that. And I think it's amazing how some of these sort of things that we look as curveballs, they actually end up being blessings later on, and certainly to us, because that meant that she started pursuing her own, for her own sake and for her own sort of well-being, learning about other modalities of treating the condition that she had. I hope you don't mind. She's a diabetic. She was on insulin, finding that the pharmaceuticals are not really sort of dealing with the root cause of the problems, and she needed to do a lot of work herself to optimize her health. And so geographically, she moved from Eastern Canada to Western Canada, and in that time researched more about nutrition and the sort of biochemistry of foods and how to actually get down to the nitty-gritty biochemistry and help herself. In this time, she was also able to help other people that perhaps had not found any solutions in sort of conventional, sort of normal Western medicine. Not saying that this isn't really well rooted in good science and good evidence base. It's just perhaps it's overlooked for whatever reason, really. And through her journey, through helping herself and helping other people, she's built up this body of knowledge, which we're really honoured for her to actually share with us today. So we've chosen the topic of histamine. I think it was partly because there was such a good response from the posts on the evidence-based nutrition. It's something that we come across a lot of. Antihistamines are sort of ubiquitous medications that we use from sort of day one with hay fever, reflux. And I think it's going to be really interesting to actually go down into the biochemistry of this. So without much further ado, I'd like to hand over to Rahat, and we can share our learning experience with her.
Thank you so much, Feroz. Okay, so as you know, the topic is it's just an effort to understand the histamine. And we're going to cover quite a bit about it, hopefully. Otherwise, we may have to move to, we have to go do another session later on. Okay, what's going on here? Okay, so today what we're going to cover in our webinar, first of all, we're going to recognize the problem, because obviously without recognizing, we can't really identify, and if we can't identify, we're not going to be able to treat it. It will just pass by us, and we may not even recognize that this is the histamine issue. Then we're going to learn about what is histamine, how it is metabolized in our body, what are the genetic factors that may increase the susceptibility, and what are the other factors that actually influence those genes as well. There may not be a genetic factor, but other environmental factor that influence it. What are other non-genetic factors that affect the histamine? The hormones, particularly estrogen, because it really goes hand in hand with histamine. So we're going to discuss that. And obviously we would need to learn about signs, symptoms of histamine and histamine intolerance, particularly in relation to the food. And at the end, we will try to at least go over some basic principles, how to deal with the histamine intolerance. So because we need to recognize, so I'm going to start with some of the case studies just some simple scenarios that you may encounter pretty much every day in your clinics. For example, there's a child who loves to eat pizza, and the mother comes and say, "Oh, he just keeps getting these repeated epistaxis, so nosebleeds." And she mentioned, "Yeah, and my child loves to eat strawberry, and every time he eats strawberry, I notice there is this blister formation or some sort of eczema, particularly around his mouth." Case number two, young boy, he can't really play or keep up with the game when he is, playing football or whatever the kids play, because he gets short of breath more quickly than other kids. They all look the same. This boy may be a little bit chubby or may not be chubby, but he just becomes short of breath very quickly. So the same story, got diagnosed as asthma, put on inhalers, but it is not helping the child. Even if he takes inhaler before going for the play or during the play, it is just not helping him as much as expected, as we might see in a real asthmatic patient. Then there is a mother who wakes up and he just constantly sneeze, and sneeze. And she is very heat intolerant. During summertime, if she has to work in the kitchen for long hours, she may break into hives. She may have eczema going on, and all her life, even after having given birth to a couple of kids, she is like 30, 40 years old, but still she has off and on cystic acne on her chin area. Another young college student complains of heavy periods, and before the period, she feels like she is more bloated. Her breasts become tender. She may have a couple of times dysfunctional uterine bleeding, DUB. Off and on during summertime, especially, she breaks into hive even if she walks just a block, and she noticed the sweat even causes hives to show up anywhere in the body. And sometimes she even requires steroids to go by the day. And obviously she feels constantly tired. Another significant point is she mentions that, I have to keep multiple pair of jeans, and before the periods, during the first 2 weeks, I may be using size 10, but in the last 2 weeks, I may go up to size 12 and 14, which means she's gaining and retaining water a lot. So her bloating is really significant point there. Another case, a 60-year-old male and complaining about insomnia. And as soon as he hit the bed, his whole body start itching. So that's a very significant issue in itself, which is going to cause further problem with the sleeping. And when he sleeps, the sleep is really shallow. And moreover, he does mention that, yes, I do feel depressed and I don't have energy. Another case, 45-year-old male with pot belly. So usually pot belly means there is going to be some sort of dysfunctional bacteria in there, some dysbiosis, because it is a sign of bloating in males as well, right? And he mentioned that he loves chocolate, but every time he even takes a small piece, he gets these migraines really bad. And no matter what type of medication he takes, he usually, the whole thing usually takes its course like 2-3 days sometime to actually get the migraine under control. So medicine does not really affect him or help him with the migraine. Same case with females, but here they mention that every time I have migraine, I notice it's around the periods time. So these are in all these cases, whatever I have highlighted in this red maroon color, these are significant key points. So keep them in mind. Another case scenario, 44-year-old female complaining of gastroesophageal reflux. She feels nauseous all the time. Sometimes she is dizzy and have orthostatic hypotension going on. And occasionally when she suddenly gets up, she also feels tachycardia and blackouts. Overall, his blood pressure is usually low. And she tells me that it's always pretty much around 100/60 or even lower. Case number 8, 70-year-old female, lifelong arrhythmias and chronic fatigue. These arrhythmias do not respond to the treatment well. a young male, he's a smoker, but he always have this postnasal drip and hypertrophic rhinitis. So congestion is a major issue. He's always also complaining that increasingly developing these food intolerances. So previously he was able to eat whatever he liked, but now uh, even his favorite pizza, he would just pass it because he can't really take it anymore. And he may be developing intolerance to milk and dairy products. He does complain about developing brain fog and shallow sleep. He's restless, and especially at nighttime, even when he sleeps, he wakes up with uh, uh, really drastic nightmares, in which all his dreams are very catastrophic type of conditions. So it's not a normal nightmare because based upon fear. It's just something which is like which puts him into a fight and flight mode, that type of condition. And he admits that his anxiety is really affecting his work. Previously he was very confident, but now he cannot even like speak in the meeting with confidence, and his hands are shaking, and he's always having these anxiety type of panic attacks too. Another case, 47-year-old overweight female, and despite all the effort, she mentions that I have gone through multiple type of diet and exercise program, but I do not lose even a single inch of my body. There may be a few couple of pounds here and there that goes up and down, but she is totally unable to maintain it, and she regains it pretty quickly. She has a history of hysterectomy due to dysfunctional bleeding going on for a number of months. And because the family was complete, so the solution was easy, just to get the uterus out. She had a lifelong history of premenstrual syndrome, and also mentioned she had a couple of miscarriages. In her GI, she complains about excessive flatulism and some lifelong allergies going on, particularly again, the heat rashes. And she recognized herself, and she said, I noticed that all my allergies, they are so much better during the pregnancies. So the pregnancies in which she was able to maintain and did not have miscarriage, her symptoms really improved a lot. But now she is back in a problem, although she had the hysterectomy done, but now she kind of think that, my mind is constantly racing. I'm not able to get rid of the thoughts, and insomnia is setting in. That's her issues now. Another one, this gentleman. And by the way, all the cases I'm mentioning are real life cases, and I'm sure you guys also will be able to recognize them, maybe already have heard them. So this gentleman told me that he is not able to hold the steering wheel in the morning because his hands are so much stiff. He's not able to turn the fingers. He has these joint pains going on. And every time he eats a little bit of yogurt, particularly at nighttime, or he takes a drink of kombucha. He does not drink wine, but kombucha is a fermented drink. He takes that, and they causes him really bad headaches. And next day, his joint pains are really, really affecting the whole day. He lives in a cold weather, so taking a hot bath is just a necessity. But every time he takes a cold shower, he becomes extremely lethargic to the point that he has to come in the bedroom, take some rest before he can actually dress up. Another case, this person has been exercising all his life, but now notice that not only he is developing some exercise-induced asthma, but also he has this heat rash, or he feels very flushed and itchy. And even when he just take a normal brisk walk, I'm saying he, should be she, the rings in his finger, they become tight. So that means the rings are swelling up. And she can't really wear closed shoes for a long time because it just makes her very uncomfortable. So the common thing among all these 1 dozen scenarios, they're all different phases of histamine. They come, sometimes they come in a combination, sometimes just one single one. And the idea is that we get familiar with all these phases so that whenever we have a case, we can recognize what is the predominant feature or what is the common denominator in all those cases. So let's see, what is histamine and why does it give such a diverse type of symptoms, which starts range from like from head to toe. It's mind fog, insomnia, and then from inside out, it's even affecting the skin. And then in females particularly, the estrogen is involved. There's a postmenstrual, premenstrual syndrome and whatnot. It's like really affecting from children to adults, old age people. And you got the picture, I guess. So what is histamine? Histamine is a biogenic amine. Some people call it amine, so don't mind my pronunciation. Definitely going to be different from everyone. Biogenic amines definitely, I mean, as the name indicates, they are natural biological uh, byproducts, which means they are happening in our body as well. They are happening in different foods as well. And most of the time, the histamine is produced whenever we have an injury or allergic response. And what it does, it causes some contraction of mainly the smooth muscle. Skeletal muscles are not involved. And it causes dilation of capillaries. It leads to allergy and histamine intolerance. So in general, if we look at that, if you remember during the med school, we learned, yes, we have antigen, inflammation, tissue injuries, and all those things, and autoimmunity. They are all relating histamine. They're all releasing histamine in their process. So you might remember the triple response. When histamine is injected inside the skin, we get a red spot, a flare, and a wheal. And if you touch it, it's always warm. So those are the actually cardinal 5 symptoms of inflammation. Why? Because wherever there is inflammation, histamine is released from the mast cells. And the purpose is to bring more blood there. And obviously the blood is going to cause redness, and it's going to cause more heat because there is more circulation. There's going to be vasodilation. So oozing of the plasma is going to cause some swelling. And pain is another feature of histamine. So whenever there is more histamine, there is more pain. And this is a significant point that we need to remember, because there's going to be people who can tolerate a lot of pain. And then there are people who just complains a lot, even on a minor injury, because for them, the pain is very intense. And that is a sign of high histamine too. Okay. So if you look at histamine, um, it is present inside the body. It is related to, it's a tissue amine. And even in the plants, for example, stinging nettle, one of my favorite herb, it has histamine in it. But when we take this, it works as an antihistamine. It's really beautiful. It has these thorn-like spikes on it. Those are filled with histamine. So if you touch it, they're going to cause histamine reaction. You're going to have wheal formation or itching or flushing. But when you use it as a tea or consume it in whatever way, then it works as an antihistamine. So that's the beauty of a natural product. It causes, um, obviously it causes those normal physiological functions of histamine leading to allergies. The primary site of storage of histamine is mast cells, granulocytes. That's why, particularly the basophils. That's why the number of basophils are important to look at whenever you're checking a CBC. If you see basophils going high, that can indicate that there is high histamine. Another key point is that histamine also works as a messenger. So it is conveying messages, and that's why it is also known as a neurotransmitter. It's the blood-brain barrier does not allow the body histamine to go inside the brain, but there is a different mechanism, and histamine is produced there inside the brain. It also helps us release stomach acid. So when we have higher estrogen, it may lead to higher like GERD-like situation where more histamine is more hydrochloric acid is released. In blood vessel, as we all know, that it causes vasodilation. So I'm not going to go in detail because you all understand if there is vasodilation, there's going to be low blood pressure, and the consequences of low blood pressure are going to be those orthostatic hypotension, blackouts, and whatnot. In visceral smooth muscle, for example, inside the lung, the normal function of histamine is to cause bronchoconstriction. So obviously, when we have a lot of it, it is going to cause more constriction, and it is going to cause more asthma-like condition. Similarly, there is smooth muscle in the uterus, which means it is going to constrict it. There is smooth muscle in our GI. It means there can be stomach ache. There can be like crampy type of condition. People will complain about that type of pain. It also stimulates the nerve endings, which causes not only the pain but itching. And in CNS, it works as a neurotransmitter, but normal histamine, like I mentioned, does not cross the blood-brain barrier. Inside the body, even if we are not consuming histamine, there is a normal process because it is such an important messenger that body need to synthesize this inside the body. And it is through a process which involve a histidine decarboxylase enzyme. Histidine, which is an amino acid present in meat, it is converted into histamine. And then this histamine is metabolized through P450 enzyme, and there are different pathways, which I will discuss in detail just in a while. For now, just remember that body is going to produce within our body. Histamine is produced inside our body from histidine. And this enzyme, histidine decarboxylase, is vitamin B6 dependent. The active type of B6 called PLP, pyridoxal 5-phosphatase, it is dependent on that. So this should make a mental note that vitamin B6 is very, very important. Particularly, pretty much all protein metabolism is dependent on B6. So it is very important for this one too. And here's just a recap of some of the important points, that because it works as a neurotransmitter, just like other neuroamines like serotonin, dopamine, etc. It does, when it stimulates the brain, now we need to understand what type of neurotransmitter it is. There are excitatory neurotransmitter and then inhibitory neurotransmitter. Histamine is an excitatory because it makes a person more alert. It is involved in arousal. It's affect our memory, learning, and even our body temperature control, pain control, and appetite. They are all controlled by, or to some extent, they are controlled by histamine. And whenever there is CNS involved, the symptoms will be, of course, headache, nausea, vertigo, irregular circadian rhythm. The sleep will become really altered. And then other organs involved, which we're going to go in more detail and just in a while. So some of you may already are familiar with this, that histamine disorder are pretty much well known. Some of them are very rare, like mastocytosis, but mast cell activation syndrome is now being really recognized more and diagnosed more frequently. And what happens is, even if the mast cells are not higher in amount, like mastocytosis is not there, those cells are just not stable enough to contain histamine in them, and they keep releasing histamine. Dr. Carl Pfeiffer, some of you may be familiar with him and his work, which is now taken by Dr. Walsh. I think his name is Robert Walsh, I think. So he talks about histamine a lot, and whenever there is high histamine, The term he uses is histodalia. I just want to mention these things because you will come across these things where patient have, they may have seen some of them, or they may ask about you about this thing. So basophil, higher number of basophil will indicate that yes, possibly there is higher histamine going on. But overall, if you are familiar with the process of methylation in the body, if you have studied it, so um, this will translate as a undermethylation. And I will explain in a little while why it is undermethylation and what is the role of methylation in this whole process. So according to Dr. Pfeiffer, the normal histamine range should be 33 to 65 nanogram per ml. But in histodalia, when patients have high histamine, it may go above 70. Diagnostic point is at least it should be 70 nanogram per ml or more to qualify as a histodelic patient. Here is actually a report. When I first time read his book and I encountered this is the report of my very first patient. I checked that and her histamine was 112. Ideally it should be, according to this lab, it should be less than 9. And even by the definition set by Carl Pfeiffer, 70 nanogram should be enough to cause that. And her was 112. So yes, the problem is there. We went over some normal physiological function. Now we need to see when is it that histamine become pathological. It is normal, I mean, it should be there, and it has a lot of function. So just by keeping the physiological function in mind, we can understand when it is going to become pathological. For example, vasodilation is so much important for our well-being. But if it's too much and it's happening all the time, and a person is feeling uncomfortable with flushing and reddening, then obviously now it is affecting the life. If it goes on more, it's going to cause hypotension all the time. So the person may be always complaining, I have headache, or if I sit up or stand up, I feel dizzy. So obviously they are lying all the time in the bed, which is not good. It's affecting their life. So now it's pathological histamine. Similarly, with increased vascular permeability, it can cause urticaria, angioedema. It can cause stuffy nose, runny nose. Especially, I have noticed that even it's not just about heat, because heat makes mast cell unstable and they release more histamine. But even in cold weather, people will have runny nose. So extreme cold and heat, they both affect them. And I don't know why, but I could not find a mechanism for it. But I know that body temperature is also partially controlled by a level of histamine. And definitely heat affects the mast cell. That much is pretty much a common knowledge. Similarly, in kids, if a child is always complaining about earache or have otitis externa, otitis media going on with epistaxis, first thought should be high histamine. If their itching is there, everyone can recognize. If heartburn and reflux is there, now inshallah, all of us will think about it, that this may be histamine issue. Headaches, throw in some other related symptoms, and if you see more than 2 symptoms at one time, think about histamine. So anxiety, panic attack, these are not just psychological issues. These are happening at certain times when histamine is high. Why histamine is high at that particular time, that's something we need to look at and figure out what that particular individual have going on, what is causing it. Fatigue and listlessness is a very common feature, and I find it pretty much in every case. And it's just, you just have to ask. Mind fog, brain fog, confusion, anxiety, these are all also excessively happening because of I guess, the level of nutrition in our food, which is required. So overall, when we talked about that, why histamine has such a diverse effect in the body, it's because of a number of different receptors. So the first receptor that was diagnosed was named as histamine 1 receptor, H1 receptor. And that was diagnosed in smooth muscle and endothelial cells. It affects obviously our blood vessels, and some of the medication we use, they affect that. They block those H1 receptor, and those are the Benadryl and Claritin type of medication. Then they identified that, okay, histamine receptors are also present in our gut, mainly the intestines and stomach. So those were called H2 receptor. And then we have medications which block H2 receptor, which are far more common over the counter, and pretty much everyone uses them who have allergies. H3 is mainly in the CNS, and H4 receptor also are present in different type of organs. They are also in WBCs, small intestine, spleen, colon, bone marrow, and all these are all involved in different organs. So if we look at this visual help, so you can see H1, H2, H3 receptor. Symptoms, why someone will have more brain and GI symptom, it may be that histamine is affecting their H1 and H2 receptor only. Why someone is only having tachycardia and dumping syndrome or shortness of breath, but there is no insomnia, it may be because it's the H3 receptor which are being affected. When and who will get which type of receptor activated, I tried to figure it out, but I could not. I have no idea. Overall, all these receptors, they lead to a number of symptoms. This particular program is from a very, very interesting and very detailed article. I think it's the title is Histamine and Histamine Intolerance. And I don't remember the author, but I will inform you about that. I'll give you the link too. And I think I have already shared that in EBNM group. So just go and type in histamine and histamine receptor. I have uploaded the whole article because it is so important that you cannot really rely on just the synopsis of it. So read the whole article. And you will see that these H1 and H1, H2, 3, and 4 receptor, they're affecting different organs, and then those organs are causing different symptoms. So just memorize it and keep it with you, and it will be so much easier to diagnose and quickly figure out what's going on. And other really interesting flowchart is this one, which goes over in further detail, talking about in relation to histamine receptor and the symptoms. So you can quickly, if you like make different copies of it, you can quickly check it when talking to patient and see, okay, which symptoms are predominantly present and why. Some of the things I have discussed this chart in EBNM2 that explains some things which are like hypotension versus hypertension, why we can see both of them happening. So you can read the details there, and we will go over some other details. If you guys have any question about these things now, for sure we can go over those in detail, or we can talk at the end. So, yes, go ahead, please. Feroz, you are muted. I can't hear you.
Okay, I was just saying, if anybody's got any questions, I mean, you can use the chat function and we can just collect them. It might make it a bit easier so that we don't lose the flow, if that's okay. But if there's a chat function at the bottom, so we can, anybody who wants to ask a question can ask there so that we don't lose the flow, if that's okay. But if anybody's got any questions now, please shout out.
I'm not much familiar with the Zoom, or have used it, but not with the chat function. But definitely we can figure it out quickly.
Yeah. Hold on, who's speaking? So would you like to just repeat that? Because we didn't quite hear you. So Rahat, is this particular diagram infographic in the group?
Yes, it is.
Brilliant, okay.
It is available. And I think we all must keep it. It's really important.
Yeah, looks really good. So I'm going to mute everybody else again and let Rahat continue.
Okay.
Okay.
It's very easy to understand. I'm not going in detail because all of you are a medical professional. So you know, for example, if there is vasoconstriction or bronchoconstriction, the effects of bronchoconstriction, for example, eventually going to lead to hypoxia. So what are going to be the effect of the hypoxia? Then you can see that. And this flowchart also talk about that. So looking at those things, you can figure out, okay, a person is complaining about, for example, cold feet all the time, and he has shortness of breath going on, maybe have migraines going on, because in the vasodilation, when the histamine affects the cranial vessels, it releases nitric oxide, and the nitric oxide causes further vasodilation, right? And that's why we get the headache going on. So just by paying attention to these symptoms, we can quickly not only understand why is it happening, but what is the major common denominator and what we need to do. We're not going to be giving a separate medication for for migraine, another medication for GERD. We're just going to like focus on reducing the histamine. And we will talk about that, how we're going to do that. So moving on, these are some common sign symptoms, which I think all of you are already familiar with, pretty much everyday scenarios, with the addition of dysmenorrhea, which I really want to emphasize that every time you hear dysmenorrhea, heavy periods leading to a hysterectomy, think about histamine. You can't control estrogen that much, but you can control histamine. And they are related to each other. They increase each other. They are the best buddy, goes hand in hand. So particularly when you hear a history that migraines or headaches around the menstrual cycle, dysmenorrhea, think about, look at the other sign symptoms of H1 receptor involvement. Go back and see, okay, what are the H1 receptor and what are the causes? You may find, okay, the person does have flushing going on, or urticaria, history of urticaria off and on, etc., etc. So you can quickly figure out, okay, I'm dealing with a patient who has high estrogen, not necessarily because that person has low progesterone, but could be high xenoestrogen and high histamine, because high xenoestrogen and high histamine are far more common than other problems. And that's what needs to be treated as well, right? Not just giving them progesterone or putting them on hormone replacement therapy, which can further increase the issue rather than solving it. It can literally cause cancer, right? So what it does is, histamine has been shown to stimulate in a very dose dependent manner. It increases the estradiol, the E2, via H1 receptor. And this leads to uterine contraction, because there is smooth muscle which is affected by this level, this histamine. This uterine contraction, what it means in clinical terms, that's going to be a monthly dysmenorrhea. But if a person is dealing with very high histamine and no means to metabolize it, and the person is pregnant, this means they can have a uterine contraction leading to miscarriage. Histamine may augment dysmenorrhea by increasing estrogen concentration, and in reverse, estrogen can influence histamine action too. So think about it like that. Both are amines. They both need to get out of the body through a particular metabolic pathway. And that metabolic pathway, the door to this pathway, is one of the enzyme is COMT, which is methyl dependent catecholamine methyltransferase, right? And there are others as well. And they all need, the common scenario is they all need methyl groups. So that door opens up by methyl groups. If the person is undermethylated, does not have enough methylation going on, then obviously estrogen is going to be there, which is normally produced in the body. Histamine is going to be even more there, because not only is produced in the body, but it's also being consumed with each and every food we eat. So in nutshell, we must remember whenever we have the highest point of estrogen, for example, the day 14, because in the first 2 weeks, endometrium is developing under the effect of estrogen. That's why it is because there is more estrogen, the more endometrium is being formed. So when we have high endometrial formation, obviously the bleeding is going to be heavy. So it all makes sense, right? And then if histamine is still high during the period's time, which is usually the case because now estrogen was high, it's going to potentiate histamine effect. Histamine is high, it's going to potentiate estrogen effect, and vice versa. It just becomes a very complex and very, they potentiate each other effect. So what happens, person is going to gain weight because that's what estrogen do, that's what histamine do. They will feel more bloated, and when they have the period, the periods will be heavy because endometrium was really formed a lot, and now it's shedding off in the form of heavy bleeding. Uterine smooth muscle is contracting under the effect of histamine, so there's going to be cramping, which means dysmenorrhea. Make sense? So if a person is taking any other thing like external hormones in the form of hormone birth control pills, it is going to affect as well. If a person has progesterone deficiency, which in other words mean relative estrogen dominance, or if they have a lot of xenoestrogens in their life, like they love to use perfumes, they use a lot of chemicals to clean their home, or they work in a hospital, for example, where they wash those floor every day with so many chemicals, so you can't really breathe. It's that much amount. I personally experienced that, particularly working in pathology department. So not only the bleach, but also the formaldehyde, they took the major toll, which I learned after a number of years what was causing all my issues. Another point I want to mention here is the estrogen, the histamine is also, when we will talk about its metabolism in a while, one of the enzyme is DAO, and this enzyme is also produced by the placenta. So just remember that, and we will go over it in a little bit detail. Just the fact because this placenta produces DAO, let's see what's going to happen during the pregnancy. These are the female, if you remember when we went over the 1 dozen scenarios at the beginning. In those case scenarios, there was a female who mentioned, yes, my allergies goes away during the pregnancy. She feels better during that time. Why? Because that enzyme DAO, which is supposed to metabolize the external histamine level in our gut, it is produced 500 times more during the pregnancy by placenta. So this is helping that female, and it's important. It's a game of survival. If a placenta does not produce enough DAO, chances are that high histamine in the female is going to lead to miscarriage, right? And it is also related to progesterone, which I don't completely understand the mechanism, so I'm not going to talk about it. But I do want to mention that a female who is low in progesterone, which is necessary for maintaining the pregnancy, in the presence of this hormonal imbalance, chances of having a miscarriage become so much more, just because now we don't have enough DAO being produced due to due to insufficient progesterone. So don't quote me on this. This is something I'm still trying to understand, but medical studies have proven time after time that yes, during pregnancy, more DAO enzyme is produced, so histamine does get metabolized much better. And I'm talking about extracellular histamine, not intracellular histamine here, okay? This is another table from the same article that I mentioned, which is, this is the PubMed ID number written here, and it's present on EBNM group as well. When you look there, the author does talk about the level of histamine, that the symptoms appear depending on the amount of histamine in the body. So for example, initially there may be just the gastric acid secretion and heart rate may be going up when the histamine level is like say 1 to 2. But when it goes up 100 or above, not only the person really feels difficulty in breathing, particularly around any xenoestrogens, so the chemical sensitivities sets in. If they go out, for example, to watch a movie or in a public place or in a gathering where people are wearing perfumes, that person feels literally suffocated and they can go in cardiac arrest. That's why at least in North America, when you go to ER, you may see a sign which says your perfume can literally send a person to ER with cardiac arrest. And this is the reason. And this is why it's important that more and more workplaces uh, are now being told to be perfume free, scent free. Even a hairspray, they can cause these problems. Even the smell of the food, sometimes they can cause these issues too, because it just depends how much high histamine they have. So as you can see, at 100 or above, even cardiac arrest can happen. And if not cardiac arrest, definitely the the psychological issues, like it is related to bipolar and schizophrenia too. It's the person literally become hysterical and we are unable to control them. Very hyperactive and strong. So this is where the normal physiology turns into a pathology by overexpression of those things. So how does that happen? Obviously, a common sense is that, okay, either we are consuming too much histamine or producing too much histamine, or too much is going out. I mean, metabolism is affected. This particular article, it's actually a blog post, and I really like this picture, so I'm sharing it here. They took an analogy of a bucket, and they say it all depends how your bucket is, how much this bucket is full of histamine and how much is coming out. Obviously, every day we are going to consume histamine. It is going to being produced, but if the exit door is kind of jammed, which means either those genes which are responsible for histamine breakdown, they are not functioning properly, either due to genetic SNP or due to other factors affecting their functionality, then the bucket will be full. And as soon as it overspills, it's going to cause those issues. So I really like this analogy and diagram. So this means we really need to understand histamine metabolism. So let's have a look at that. Histamine in, like we talked, if it's coming too much, obviously it's either coming from the food or being produced in the body. And histamine out is dependent upon two major enzymes, DAO and HNMT. Just remember, DAO is the enzyme which is present in the gut. And like we just mentioned that placenta also produces it during the pregnancy. So it is only tackling the extracellular histamine. The intracellular histamine, which is more related when we speak about, talk about some other organs like brain, HNMT is the major one. And this MT means histamine N-methyl transferase, which means this enzyme is dependent on methylation, methyl groups, presence of methyl groups. So overall, when we previously looked at a slide talking about histodalia and undermethylation, which means if these methyl groups are not available, it is still going to affect the HNMT even if there is not a genetic SNP present there. Make sense? So high histamine, uh, it's going to result, different factors is going to affect that, including B6. Our gut dysbiosis is a major one, estrogen levels, histamine level, and all other things that we just talked about. So let's talk about the genetic material, genetic factors. So HNMT and DAO, two of the major ones. And studies show that 30 to 50% reduction in their function is seen if there is a genetic SNP. And they are very common SNPs. And sometimes it's the epigenetic which is affecting them, but the result is the same, that their function is reduced. And once that is reduced, obviously the symptoms are going to be there. If you are interested or if you are studying methylation, then this may be important, because when patient come with their genetic test result, you can look at these particular SNP. All SNP have a RSID, which is far more important than the SNP name. And it is also important to notice that DAO enzyme is also called ABP1. So some of the genetic reports are going to mention ABP1 instead of DAO, although DAO is more commonly used. And the RSID is always the same. There are more than one type of RSID associated with that gene, which means there can be more than one type of SNP polymorphism in them. But not all of them are clinically known to cause a deficiency. So particular ones are important. If you see this particular RSID, it is going to cause increased risk of migraine in women. These are all based upon this. I have provided the links here. These medical literature, they talk about these, that if we have this SNP, there is increased risk of migraine. There is increased risk of higher histamine in blood. There's gonna be reduced DAO activity by 30 to 50%. Then another one, RSID 1229984. It is not called as DAO, but ADH1B and risk alleles T. And again, what is going to cause, it's increased risk of heavy drinking, increased risk of head and neck cancer, although it is not related to histamine directly, but it does play a role. It's definitely more complicated than my capacity to explain it here. So certain type of cancer risk goes up, and ALDH2 is very common SNP, and I see it time after time in many patients. And there are certain type of risk associated with them. Especially there are people who have high histamine, and then they will tell you, I can't really take any NSAIDs. Even aspirin causes them hives or respiratory symptom or Rye syndrome, as we all know about that. So those are related to this particular SNP. If you check their genetic report, you may find they have a SNP here, which causes more susceptibility to certain drugs, particularly anti-inflammatory drugs. Here, for HNMT, this one has this. I took it out from Sterling's app, which is one of the way to translate the genetic material. That app gave us far more information than some common ones, and I really like it. And this is where she talks about all these histamine-related genes and their SNP. And you can make a note of them. And if you want to read more about it, there are many websites available. Also on Public Health Library, there is a lot more detail available in that. If we studied methylation together, then I will show you those resources and definitely go in further detail. So overall, DAO and HNMT, two major enzymes. Just remember the intracellular one is the one which is mostly causing the asthma. And it is on chromosome number 2. Extracellular is usually going to cause more food intolerances because it is present in the gut, the DAO enzyme. And people who have any type of gut pathology, for example, Crohn's disease, whether it's IBD or even in IBS, there is a major role of histamine. And most commonly is because of the DAO, which is present on chromosome number 7. We don't need to remember these things, but we do need to pay attention on their function and on the location where they're produced. For example, DAO, intestine, kidney, and placenta. And that's why people who have more histamine, I'm actually struggling with one case where proteinuria is a major issue, histamine is a major issue. So he's a young child who have high protein urea nephrotic syndrome, as well as epistaxis are so bad that they are pretty much happening every other day. So reducing the histamine is quite a challenge because, again, kids do not like to eat everything. And he's very particularly like attracted towards pizza and these French fries with cheese on it. And cheese is another major source of it. So unless patient really understand, the parents understand, and the doctors understand that this is which is causing the issue, we cannot treat everything with medication. We need to change the lifestyle. We need to eliminate those factors. So yeah, and HNMT, it's also produced in kidney and liver, and it's also produced in spleen and colon, but mostly also in the lung. And storage, pretty much you all know, it's associated in epithelial cells and mast cells. And the function, we already talked about them, and you can read them in detail for your understanding. Really want to share this one. This is the pathway planner from Dr. Ben Lynch, and this is the histamine planner, histamine pathway. So as you can see, that histamine is histidine, which comes from the protein, or the meat. It is converted into histamine with the help of this enzyme HDC, which is histidine decarboxylase enzyme, and you need B6 for it. Similarly, like we just talked about intracellular and extracellular, this particular goes into intracellular, like it is going to increase the histamine inside the cell, and the enzyme responsible is HNMT. HNMT is methyl dependent. That's why SAM is there. SAM is the major methyl donor. If we don't have this enzyme, even if it's totally normal, it is not going to function. Next enzyme responsible for its breakdown for methylhistamine, it is going to be broken down by MAO-B, not MAO-A, MAO-B enzyme. So if there is, FAD is the cofactor. If FAD is deficient, let's say riboflavin deficiency, FAD is active form of riboflavin vitamin B2. So even that is going to affect it. Similarly, in the next step, when N-methylhistamine is broken down into N-methyl imidazole acetaldehyde, this is very important, very common problem. This ADH enzyme is dependent on so many cofactors: zinc, vitamin C, niacin, B1. NAD is the active form of niacin. So get familiar with these terms and write them down if you need to. So if there is a deficiency, let's say vitamin B1 is deficient, patient is hypothyroid, patient is diabetic. These are the two major population who are very deficient in B1. Pretty much every diabetic is deficient in B1. What is going to happen to this enzyme? Their capacity to metabolize histamine intracellularly is already affected just because of deficiency of one vitamin. Then zinc and copper imbalances that I really think are so much important that I keep writing about them again and again. If that is the problem, if zinc is deficient, which is again a common problem, right? Again, it's going to affect this enzyme. And what happens when acetaldehyde is higher? These are the people, sometimes they are the same who actually have more candidiasis in their gut. So with the presence of fungus, because fungus also produce acetaldehyde, the problem keeps becoming worse and worse, because now this compound is really getting higher in the blood and it is not breaking down. And what happens is the result when we have acetaldehyde, high acetaldehyde, because it is, think about it like that. Acetaldehyde is also a metabolite of alcohol. What happens when we drink a lot of alcohol? Hangover. What is in the hangover? Brain fog. They can't understand simple things. So this is exactly how these patients feel. So high histamine and high acetaldehyde, whether it's due to this metabolic pathway or due to fungus in their gut, end result is the same. So brain fog is a major complaint there. Extracellularly, the DAO enzyme present in the gut, certain cofactors are needed. Again, copper, calcium particularly. Calcium is very, very important. And we do need to support our patient with calcium. Otherwise, in the long run, not only histamine, but their oxalates are going to get higher. So keep a good note, mental note about calcium here. And certain medication affect this, like amiloride. There is a long list long list of medication which affect this enzyme. I will share those with you. Again, acetaldehyde, imidazole acetaldehyde, and this ADH enzyme is the same, which was working here, and cofactors are the same: zinc, vitamin C, niacin, and B1. And when the end products are formed, imidazole acetic acid or N-methyl-imidazole acetic acid, these are the ones which are eliminated from the body through urine. Also, just have a look that this MTHFD1 or folate cycle is so much important for this too. And some of you who do test FIGLU, you will realize how important this becomes. Okay, I think I should move on. I'm talking too much in detail. So HNMT function, pretty much I have already discussed. And the medication that inhibit HNMT function, they are very common, like we use antihistamine all the time. Then we have antimalarial drug, antifolate drugs, also used in cancer treatments, right? They all affect the HNMT, and overall the methyl groups definitely also going to block it. And some of the medications are also very common, like MAO inhibitors. They can also affect this. So again, pretty much the same information here in for more detail. And I have mentioned this, found this article really nice, so I put it there if you want to read. I want to touch base about bacteria. Bacteria are so much common, and you know how many people have Klebsiella or E. coli going on, or when we have those stool test analysis or GI map done, you can see their dysbiosis is so much predominant, and they may lack or they may have overgrowth of certain bacteria. These are the bacteria which are particularly affecting the histamine production. Why? Because when we talk about this enzyme HDC, which converts histidine into histamine, so they affect this HDC. See here, in the orange, these are the factors which enhance the production of HDC, enhance the functionality of HDC. They are not inhibiting it. Inhibitors are written in purple color, for example, SAW ratio. So SAM will promote it as a cofactor, SAW will inhibit it. In orange, I have mentioned here, Dr. Lynch has mentioned, like this is a bacteria, and other amines like putrescine, spermicine, spermidine, which are usually present in the very same food which has histamine. These all biogenic amines are present in the same food. So what happens, they promote this HDC, so more histidine, if there is B6 present, more histidine is going to form more histamine. So after food containing meat, this is going to happen. And if that person has been taking, let's say, bone broth, which is very popular these days, and that bone broth has been cooking overnight, which means has a certain aging going on. So naturally, it already has certain amount of histamine. I don't know how high or high low, because it depends how fresh was the meat. Was it frozen or was it just a fresh cut? And how longer was it used to brew that bone broth? So all those things are going to affect that. Okay, now we have histidine present in the bone broth too, and it's going to form more histamine too, particularly when we have those gut bacteria already present in the body. So bacteria, and the yeast as well, they display high HTC activity, and that's why they cause more histamine. And because these are bacteria are everywhere, they are present on all the food, and even if we wash them, and then many times we are not even very much careful, so we put our meat outside thinking meat does not have histamine. So meat is thawing on the counter, or fish which is already frozen, and we put it out thinking, okay, I'm just gonna prepare it when it's thawed down, but it creates a lot of histamine. And if fish is whole, then it's an other really major problem, which I will go over if we have enough time. But for now just remember, all gram positive and gram negative bacteria can cause more high histamine. So it is important to handle and treat all those possible infections if we really want to get rid of the histamine issue. Then we have Dow histamine, histamine affecting other factors. Already covered copper, B6, and vitamin C and riboflavin. It is constantly obviously released from the intestine, and certain, if there is a pathology in the gut, it is going to affect it. In the pregnancy, we already covered that it is produced more. I just want to mention about SAM and SAW ratio. Those of you who are studying methylation, you may already know that if we always look at the ratio between SAM and SAW. When we utilize SAM, like methyl group is used, we produce SAW. And in the body, there should be a certain level of a certain ratio between them. When we just look at here, if you see this HNMT enzyme, SAM is the cofactor and SAW is blocking it. So in those people who utilize more SAM, but their capacity to recycle the SAW back into SAM is not there, then SAW will accumulate, and that in turn also affect HNMT. And due to which, obviously, the end result will be the same, which is high histamine. So this SAM-SAW ratio, in my opinion, and also I have discussed this with some other naturopath I studied with, Dr. Caroline Lidowski. She also talked about the same thing, that accumulation of SAW can affect this thing too. And this means we really need to balance the methylation. Otherwise, we cannot possibly treat the whole situation. So this was the genetic. Now, what are the non-genetic factors which affect? So let's quickly go over hormones, medication which affect, stress level, and food. In hormone, number one is the estrogen. I have already explained a little bit about it, but just remember, estrogen and histamine, they go hand in hand. They potentiate each other. If one is high, the other one is going to high too. And it's like a vice versa condition. When we have insufficient DAO in pregnancy, leads to complication in pregnancy. Usually placenta should be producing more than 500 times DAO. But if for whatever reason it is not being produced, we do get literature mention that there are more complications associated with it. For example, gestational diabetes, miscarriages, disturbance of trophoblast, premature rupture of fetal membranes, and premature birth. These are all known complications with low DAO in pregnancy. We already spoke about this, and I hope it's clear. If you have any question, let me know about that. And this also, just remember, when we are talking about estrogen dominance and we are trying to treat it with so many other things, whether we are using DIM and calcium D-glucarate to help metabolize it, but it is not going to solve the problem, or especially if we just take the progesterone, that is not the answer anyway, because it is going to, histamine is still there and it is still going to cause more and more higher histamine level, right? So that's why even hysterectomy is not going to solve the problem. It is just like shooting the messenger who was warning you that there is a problem. Other things which affect are obviously antihistamine. Every time we have high histamine, like allergies, everyone picks up antihistamine. Even those who have sleep issue, antihistamine does affect them because one of the side effect is sedation. And also they block those receptor in the CNS, the H3 receptor. So particularly those medication, they are going to help. But in the long term, when we keep using that, body thinks we do not have sufficient amount of histamine. So as a result, uh, the histamine production may be upregulated, and the problem never gets better. It actually starts becoming worse and worse over time. In addition, over-the-counter histamine, which block H1 and H2 receptor, they are also causing major issue in the long run. So they are not the answer. Stress level. Every time we have stress, we use more methyl groups. Stress really depletes our methyl groups. And we did go over that how methylation affect our capacity to metabolize histamine. This particular patient that I shared before with very high histamine level, uh, the whole problem in her case happened after a very stressful event. So perhaps she was already undermethylated, and just an acute stressful condition caused a lot more problem, where she literally went into hysterical mode. Food additives, so much common everywhere. They are there are food colors, there are food preservative, particularly tartrazine and azodyes. They're very common. Food color yellow 5 particularly. They are very commonly used in all the foods that kids eat. So you can imagine how much problem there will be, and how they are all contributing towards high histamine level. So high yellow 5 is usually present in candies, ice cream, ketchup, salad dressing, hot dogs, and we must eliminate these if we really want to tackle the problem. Other food additives, food and food additives, um, they they can all contribute a little bit towards the histamine with our food choices, and that's why we need to be mindful about them. Dysbiosis in the gut, I previously talked about the bacteria. So definitely dysbiosis affect the amount of histamine production in our body. And if we have more histamine producing bacteria in the gut, problem will get worse. But luckily there are bacteria who actually promote the DAO enzyme too. And there are those who, particular probiotics available who do not have histamine producing issue. So those probiotics are really good choice. A common scenario is someone just picks up a probiotic thinking this is going to help. And then they complain, oh, actually my flatulence has gotten worse. My bloating has gotten worse. And this is simply because the gut is so much dysbiotic that now they are producing more histamine than anything, than get feeling any better. So we have to be mindful when choosing a probiotic, because it's not same thing going to work for everyone. In the same article that I mentioned, they use this flow diagram, which kind of is an easy way to proceed when we are when we go towards the treatment part. So we look at the symptoms, and if there are more than 1 or 2 symptoms related to histamine, we can ask the patient to keep a diet diary, and we can look at other factors in the epigenetic, in the lifestyle. And with the diet diary, we can see what foods the person is more reacting to, what symptoms are becoming more prominent, and then we can see if those are the foods. Usually these are the food which are high in histamine naturally, or they are releasing histamine. For example, this one lady, she mentioned that every time she eats banana, she gets sore throat. She cannot tolerate it. So banana may not be high in histamine all the time unless it's very ripe, but it is a histamine liberator. So even when they are not eating a very ripe banana or overly ripe banana, they are releasing histamine because their mast cells are so much full of it, and they're not stable enough, maybe that person is diabetic who is deficient in B1. So just one banana can cause them sore throat. Um, and then let's talk further about the treatment. We have to keep this metabolic pathway in mind, because we have to figure out where is the problem, whether it's genetic or epigenetic, and how to handle them. So our treatment will definitely depend upon presence or absence of those things, which are very individualized. Overall, there are certain foods which are high in histamine or high in other bioamines like tyramine, and they are more problematic. So for the short term, we can tell them not to consume too many of these foods. The list is also provided at EBNM, and I'm going to go in further detail here as well. So just want to mention one thing: histamine and food intolerance. Many people consider food intolerance same way as food allergies. Food allergies are IgE mediated, and they are different. They appear right away. Food intolerance they are not immune mediated, and they are more enzymatically produced. Like the enzyme is not functioning properly, or histamine is high, and they can gradually become worsen. And over the time, people can become more and more intolerant to different foods. And this is, I just wanted to emphasize on this point that food allergy and food intolerance are two different things. Then high histamine foods, basically everything which is fermented, whether it's sauerkraut, vinegar, kombucha, kefir, yogurt, all these things are high because fermentation requires bacteria. And as we just previously learned, bacteria affect the HTC, and they promote the formation of histamine by converting histidine into histamine. Although vinegars, particularly apple cider vinegar, people become very afraid of it. But when you look at the content, it is the least amount of histamine in it. I think it's very, very minimum. Plus the fact that you are not going to take 1 cup full of vinegar, you're only taking 1 or 2 tablespoons. So the amount of histamine in it far less than its overall benefit. So I do still suggest to take apple cider vinegar, particularly because it does help with GI symptom, with GERD and all other symptoms. It's very good, very helpful. So vinegar containing foods overall, like pickles, mayonnaise, olives, anything which is stored in the vinegar may have high histamine. Cured meat or anything which is processed or produced by the process of aging, they are going to be high in histamine. For example, dried fruit, they may not otherwise have histamine, but they are dried. So over the time, they do get more biogenic amines in them, particularly putrescine, which further causes more problem. So that's the same case with the walnuts, particularly cashews and peanuts. Many people are allergic to them, and the reason is the presence of those bioamines, which kind of work the same way and have potentiate the histamine effect. In vegetables, avocados are generally high in histamine, particularly the ripe one. All the nightshade ones like eggplant and tomatoes, they are high in histamine. Spinach or any leafy green vegetable which wilt very easily, they are high in histamine. So a patient may come, and when you ask them about food they ate during the last 2 days, they may say, yeah, I cooked spinach, and yeah, I had spinach and potatoes for dinner, and then leftover in the lunch. And yes, I made eggplant, particularly. It's a very popular dish where a lot of tomatoes are used with the eggplant. So yes, I ate that eggplant burta, and now I'm broken into hives. So particularly leftover ones, they're going to cause more problem. And definitely when we are treating them, we have to advise them not to use them too frequently, at least at the beginning. It does not mean they have to avoid this food forever. It's just temporarily processed. So by default, every leftover food is going to be high in histamine, which means the first thing they need to do is cook fresh and eat that food right then and there. Easy way to remember when educating the patient, tell them all vegetables which are nightshade, dark in color, all vegetables and food which has thin skin, whether it's um, bell pepper or strawberry, they are going to be high in histamine. Anything which is fermented or prepared by aging process, anything that rots quickly like green leafy vegetables, anything that starts giving smell like fish, they are going to be high in histamine. So freshness really counts when we are treating with this issue. And food that does not seem to have histamine, but they do cause problem. Like I just mentioned some nuts like almonds and other nuts, strawberry. These are the foods which release histamine. So yes, and they have more other biogenic amines in them, so they cause problem because they are converting histidine into histamine. And also want to mention just a little bit about histidine, because histidine is basically present in the meat. All type of meat will have it, but not all type of meat is going to cause more histamine. For example, if we compare beef versus fish, now fish is known to have very high histamine, and it gives off smell very quickly. That's why it's used as a reference of fishy smell, right? Or fish market smell. The reason is, as soon as the fish dies, if it is not gutted, if the guts are not removed, the bacteria in its gut, they are going to cause more, they're going to produce more lactic acid, and those bacteria can also increase the conversion of histidine into histamine. So its own meat is now producing histamine. So that's why it's important. Either you have to only use the fresh catch, or the fish which are eviscerated right away and then frozen, although it is still going to have some level of histamine. But ideally, either fresh catch and degutted or eviscerated fish, which is cooked within an hour, they can tolerate it better as compared to the other ones. So smaller fish in which the guts are not removed, they are definitely going to be higher in histamine. And those are the patient will tell you that I had Merkel fish, and now I can't really tolerate it. I have to go to the washroom right away, or I break down into hives, or whatever symptoms they may feel with the histamine. Here is a list of food which release histamine. Banana is one of them. Cow's milk is another one. Chocolate too. And papaya and pineapple, which are actually healthy foods because they have some enzymes in them. So I really like papaya and pineapple, but particularly when histamine is high, pineapple is not a good choice. Also, when you especially if they're been cut and put in the fridge, definitely they're going to have more histamine in them. The food which are low in histamine and they can eat, here is a list, so you can provide them with some information that you can get started with these foods. And I have particularly mentioned like fresh fruit and vegetable, other than some of them which are naturally high in histamine. They can help. Probiotics can also help, particularly those probiotics which uh, microorganism capable of degrading histamine, which help with by producing DAO enzyme. Here is a list, and the references are also available at the bottom, so you can read the detail. And then you have to hunt for those probiotic formulation which have these particular type of bacteria. Luckily, there are some available in the market now. So overall, the histamine-friendly species are Lactobacillus rhamnosus can help, Infantis bifidum longum. They are all really non-histamine producing, so we can get started with these type of probiotics. And as a bonus tip, I want to mention that I just spoke about pineapple, for example. It has a digestive enzyme called bromelain, but bromelain is also used as a supplement, sometime with antihistamine. Quercetin is a very popular antihistamine, which is non-pharmacological, non-pharmaceutical. But though quercetin is a methyl donor too, and it can really help with the allergies, but certain combination in the market, they have bromelain in it. So bromelain actually can cause more symptoms, and these patients will complain that this it doesn't suit them, and they have more GI symptom the moment they take it. It's simply because the bromelain is releasing more histamine, so their stores are already high, and this is not a good choice at that time. Certain mushrooms, they are helpful, they have antihistamine properties too, but freshness is really important, because if mushrooms are not fresh, they, how quickly they go bad, so they generate a lot of histamine in them. Reishi mushroom is the one which actually has less amount of it. Not all of them are high, but with time they're going to produce it. We can also use DAO's enzyme supplement, which is present in the market, but it's not good for Muslim because it is pork origin, and it may not be a good choice because it's quite expensive. And people has to take it with every time when they have food. And if you remember, when we went over the metabolic pathway, you may remember that DAO is the extracellular histamine enzyme, which means this expensive product of DAO supplement is only going to help them with the food allergies. It is not going to take care of HNMT issue like intracellular histamine, which may be causing them brain fog, memory issue, hysteria type of condition. There's depression may be worsening because of that. So this expensive enzyme is not going to help them with that. But some people do find it helpful, and it is available in the market. Overall, we have to treat the methylation, and it is a long story in itself, which definitely I can't really complete today. But just a summary, when we look at those metabolic pathway, histamine pathway, we saw certain factors which were working as a cofactor, like riboflavin and B6. Then there were other enzymes and other minerals which were either promoting or working as cofactors, so they are needed. If a person is deficient in them, if we assess them properly, we can supplement them, whether it's thiamine like B1, or overall we can sometimes use SAMe. It's written as SAM, but we pronounce it as SAMe, which is the preformed methyl donor, the end product of methylation. We can use that too. Calcium in particularly does help, and especially when in combination of oxalate issues, we have to use that. I did mention that mast cells which store thiamine, they become destabilized and they spill over the histamine very quickly. Now they don't wait for an injury to happen or a pathogen or an antigen to come across. So they keep releasing histamine even with a little bit of temperature. Like they just walk a block and the histamine is released. What will help is thiamine and other issues too. But thiamine, I noticed that there is some literature evidence that it stabilizes the mast cells. And in some cases, vitamin C is also helpful, along with the calcium. And here is the study that I just mentioned, that this particular one, that thiamine was helpful for mast cells degranulation. It stabilized them. So thiamine deficiency does cause the issue. So I think I will stop here, although there's a lot more about the treatment that we need to discuss and learn, but it's a long presentation, so I'll stop here today. Thank you.
Thank you so much, Rahat, for that. That was really, really fascinating. And actually, it makes so much sense as well from the patients that I've seen and thinking about the histamine side of it. And definitely, I've got a couple of patients I'm thinking, well, actually, I need to do this and call them back in, and we can try these probiotics and these supplements as well. Now, I know I've got two questions, so yes. I shall just put those. So, let me see, there were two. I think Breshna's was the second one. I'm trying to find the first one. But anyway, Breshna says, if basophils are normal, is there any other way of testing for a high histamine level?
Absolutely, we can check a histamine level in the whole blood. Like I showed you one of the test results of a patient. There are certain labs who check the whole blood histamine level. and like this one. This is checked in whole blood. I don't know why I have this. I put some mark there. I don't know. Oh, this one. Excuse this marker on top. I don't know what I did. So yes, this is the total histamine level, and it can be easily checked.
So
This is more reliable than basophil, because I noticed not every lab will report the total amount of basophil. They may just give a percentage, and usually it's 0 to 1. So it's very, very difficult to see basophil amount numbers going high. So far, I don't see very many patients, but in my experience so far, in patients who have really high histamine proven otherwise, their basophil number was like 0.3 or 0.4, which was not too high.
I mean, this lady is really fascinating with such a high histamine level. What does she present with?
She was diagnosed with schizophrenia.
Okay.
Her symptoms were acute onset. And as a matter of fact, she was she's a doctor working in a hospital. And I think she caught clostridial infection. And Clostridia not only is related to, I mean, like we spoke about the bacteria which cause the histamine issue, but Clostridia particularly inhibit DBH enzyme, which is dopamine breakdown enzyme. And what happens is everything accumulate if she is already, perhaps she was already deficient in methyl groups. So with undermethylation in combination with the superimposed infection, particularly affecting inhibiting DBH enzyme, the dopamine became high. And as you know, dopamine plays a major role in a lot of psychiatric issues. And it's a catecholamine, right? So when catecholamines are high, and neuroexcitatory neurotransmitter, which is histamine, is high, person become really so agitated, aggressive, hysterical, and totally insomnic and very paranoid too. And those are the umbrella terms which we in psychiatry we use to label them as schizophrenic. But treatment was the same. When I address the histamine level, when we address the methylation, we improve those things. Now it's been many years, alhamdulillah, I think 5-6 years. She does not need any medication.
Brilliant. That's really good.
Yeah.
I think methylation will be the next topic that we need to cover, inshallah, once you're back from your travels. I think Brescia had
a long topic. It requires a couple of months.
Okay, couple of months. There we have got a lecture series going on. Brescia's also asking, if progesterone is high and estrogen is normal, in the normal limit, then does DAO, wait a minute. If progesterone is high and estrogen is in normal limit, then DAO should be high. Then why is histamine still high?
Well, it's not always, number one, it's not always related to progesterone. And I really don't have a good understanding.
Yeah,
Plus, if a person is taking, I'm being honest about it. And secondly, if a person is taking exogenous progesterone, and the lab is definitely going to show high progesterone then. It does not mean a person is normally having a high progesterone. Tell me, have you ever seen a patient with high progesterone normally without supplementing?
No.
Never.
No.
I have never even encountered anything like that. So most likely the person is taking progesterone, and it's about counting the ratio between estrogen and progesterone. Just like in copper and zinc, it is about the ratio. It's not about the lab reference range. And how it's going to affect DAO in the presence of external progesterone, I have no idea. I never even looked up this particular aspect.
Okay, but I mean that's really interesting actually, and it's quite interesting how histamine is so related to the sort of the female hormones, and because so many women come with menstrual irregularities, bloating, all sorts of things, and it's really interesting that it can all lead from histamine imbalance. So that's really good. So that's fantastic. Are there any other questions at all, people? I mean, I'm sure, hopefully, that if we do think of questions and we put them in the group, then we can get some answers. And I think actually one of the real benefits of this is that actually now more of us can participate in the discussions. And I know that that's something that you really want in the group, so that we can all learn from each other. And hopefully people will pick up different things, and we can actually really enrich the discussion in the group, and all learn from each other. So I don't want to take any more of Rahat's time, because she's really kindly sort of given it to us. I've recorded this. If I can work out how to actually get the link, I'll put it into the group, and then we can always continue our discussions there. The only other thing that I was going to ask was Rahat, if some of us have patients that we perhaps want to discuss, can we make appointments to have discussions with you as well?
Absolutely.
Okay.
No problem.
That's brilliant. And we just contact you either through, I think you've got...
Yes, sure, can do that.
Yeah, okay.
Already some of them are doing it.
Okay.
But there was some people were asking about mentoring them.
Mm-hmm.
I do not have enough time available, to be honest. I think the better improvement that we can bring up in all of us is by learning methylation.
Mm-hmm.
And there are some really good resources available.
Mm-hmm.
Like I started with Dr. Ben Lynch's course, which is available. And I think he's also working on a new course.
Is he?
Then there is Dr. Amy Jasko, Yasko. She is also very well renowned researcher, particularly for spectrum disorders and methylation. Then I also spent 1 year of continuous studying, like twice a week, with Dr. Caroline Ledowski. She is excellent. She does not leave anything unturned. So it's we learn a lot of things together, and we are working on a book where everything can be present at one, and accumulated in one textbook type of thing. It's a long way to go, and pretty expensive too, I must say. So what I noticed when I started learning about methylation a couple of years ago, and the first course I took was, I read the book from Dr. Ben Lynch, related, that does not talk anything about methylation. But overall, there was a summary like histarilia and histamine. So I started looking into that. But when I took the course of Dr. Ben Lynch, I realized I was struggling quite a lot, because he maybe starts from the intermediate area, not really starts from the basics. So if in whatever biochemistry we studied in medicine was not enough for me, at least, to right away go and figure it out, what he's talking about. So for honestly speaking, for every 10 minutes of video that I watched, I might have been spending at least 1-2 hours, or maybe the whole day, first understanding the basic and then moving on to the next step. Because personally, I like to go in detail and figure it out and understand it well before I move to the next step. So I'm a slow learner. And when I teach methylation, there are a couple of medical students who are studying. So I realized when I was teaching them that actually, if we have a different approach and start right from the basic and tell them why we are doing this thing. For example, whatever course you take, they never, hardly anyone I really haven't heard. I have at least done 3 courses. I never heard, why are we even doing all this thing? What is it going to affect? And what is the medical evidence? So as doctors, we really need to have that medical evidence in front of our eyes to see all that effort that we are doing, what difference it's going to make. For example, this particular chart here, we know this is all evidence-based that, for example, B6 is a cofactor. So B6 deficiency is going to affect. And there are all these other cofactors or factors which influence it, promote it, or those who inhibit it. They are evidence-based. So we need to first understand what happens when we, for example, take vitamin B6. How is it going to affect? how is it going to treat? By learning biochemistry or methylation is not enough unless we really understand the synergistic effect and the functional effects of each and every micronutrients. And this is something which I found missing in those courses, and I'm working on them. So I mentioned in the group, I'm using Ulysses, and I'm making notes for each and every nutrient. What are the normal functions? So not always patient have enough money to have different labs available. And I absolutely don't even like the idea of getting so many labs done, the expensive one, the specialized functional medicine testing, before actually knowing what do I actually need. So it's just sometimes it seems like there are people who will share a case and they have a dozen tests done, and then they're fishing out, okay, this is wrong and that is wrong. Not always, the lab levels are not always indicative of a problem.
Mm-hmm.
Let's talk about B12 in itself, I mean, or B6 deficiency or toxicity. But we need to understand why they are what they are in the lab. And did we really need it? I think at least 50 to 75%, we can just assess if we understand if we understand the normal physiology, we can just assess them using a detailed history
Mm-hmm.
rather than spending a lot on test. And if we are missing out on learning the basic principles and the basic physiology,
Mm-hmm.
and right away jumping on the labs, the problem is patient, yes, he only used the money, but we are wasting our precious time,
Yeah.
because we are, every single time a new patient come, we are still dependent on labs.
Mm.
We are not
Uh,
learning anything unless labs are there. But
Absolutely, and I think it's actually really telling from a sort of a integrity point of view as well, in terms of, the patients are coming to us to get better, and if we're actually sending them down sort of the lab line where we're spending investing lots of resources in that, our time and their money, it's not really having a very practice with integrity, really. And also in terms of regulation as well, people can hit down on us very quickly, and I know that a lot of the physicians over here are very wary of taking too many labs just because of that, and also suggesting too many supplements, because in some ways then we're still going down the pharmaceutical line. So I think it's really good that you're saying go back to the basic biochemistry, understand where the symptoms are coming from, and then looking first and foremost at lifestyle modifications. So I think that's really, really important.
this is another major point which you just highlighted.
Mm-hmm.
A lot of people who study methylation,
Mm-hmm.
they start, and I mean, even if they have a fair understanding about the pathway,
Mm-hmm.
they start supplementing with these micronutrients, thinking this is going to help. For
Mm-hmm.
example, if I need to support DAO enzyme
Mm-hmm.
and I start giving copper to the patient without understanding how it's going to affect the zinc level and how to balance it, what's going to happen, the intracellular, which is far more important than extracellular HNMT,
Mm-hmm.
histamine. See, this, we require zinc here. So when acetaldehyde is high, particularly in population who is drinking alcohol or who have gut dysbiosis with fungal gut dysbiosis, candidiasis, etc., so they are going to take a major hit. Because number one, zinc is so much important to get rid of all the fungal infections they
Mm-hmm.
even going to have on their skin, or not just inside, but outside as well. And if we, for example, give riboflavin thinking, oh, it's so much important, it's for MAO-B, we need riboflavin. So there was a SNP, so patient is given riboflavin without thinking, what is the status of B1? Now, riboflavin cannot function unless we have sufficient B1. Niacin cannot function properly if we don't have sufficient B6. B6 cannot get activated if there is not sufficient amino acid available. So they're all so much intertwined and far more complicated. And this is why this makes me really nervous when people just think, okay, yeah, this is written here, so I can go and take it. Like recently, somebody asked about breast cancer treatment, and I mentioned some of the things. I'm very cautious about mentioning these things. A lot of people ask about my what I'm taking for diabetes, because I haven't taken any medication for 2 years now. Not 2 years, 1.5 years now. Alhamdulillah, and just managing with these things. But I am so much reluctant to mention because of I know what it can cause problem. For example, manganese is, beautiful, beautiful. I'm totally in love with this mineral, but it can cause manganism very quickly. If person don't know how manganese really get processed in the body, and a lot of people are deficient in those amino acids, so then what's going to happen, they will end up having parkinsonism down the road, which is far more complicated than just dealing with diabetes. So this is why I am hesitant talking about those things in the group. And I hope you understand it's not because I don't want to share. I am literally trying my best to share.
Well, I think that's the
Less information.
I think that's the benefit of actually having, you've set up the group so that we can have those sort of cautions and sort of caveats as well. And the more that we study this, we realise that actually it's all sort of made in a really sort of a very balanced way, and that we have to understand both sides of the equation really. But what I found really valuable is actually the resources that you've mentioned, that those sort of charts, the ones that you like with all the symptoms and things, and then also being encouraged to look into methylation more, because I think that seems to be the root of a lot of the biochemistry as well.
Yes.
Yeah. So, but
I think methylation can really solve mysterious cases. It's really beautiful. I'm really glad that I started reading it.
fantastic.
It has helped me a lot.
So hopefully we can, perhaps once you're back from your travels, we can sit down and think of a plan in terms of the methylation, if you don't mind, and we could work out, if the participants can let us know as well what topics they want to cover, then we can make it sort of a logical pattern and not too onerous on Rahat's time as well, because I know that this is a real sort of barakah that you're giving us, a blessing that you're giving us for doing this. So what I'll do now is close up now. I'll put the recording into the group, and then I just mentioned, I think Selena had a question, but what I might do is ask you, Selena, to post that underneath the recording, so perhaps we can all have a chat about it and use the knowledge that we've learned today, and Rahat can oversee it, unless of course if you want to answer any of the questions now.
Sure, whatever way you feel.
Yeah, I'm just thinking of time, really, and so.
Yes, I need to get going soon.
Yeah.
I was thinking about finishing in 1.5 hours, but it's almost 2 hours now.
Yeah, so I think we'll finish now, and then we'll post it in the group, and then we can all have a discussion. And I think the really good thing is if we all bring cases and start discussing them, because then we will learn, and it's always good to do them, to see one, do one, and then we can all learn together. So thank you once again, and thank you for all the participants. If there's any questions, post them in the group, and inshallah we'll see you again, and safe travels.
Thank you.
Okay.
Thank you so much, everyone. Take care.
Okay.
Bye-bye.
Yeah.